Yes. Yes. We were literally, I was just talking with my parents just now that it's going to be months before we recover from this. Crazy. Yes. Oh, I know. I know. I know. Yeah, a friend of mine yesterday was just saying that his daughter, that they were signed up under that gig or whatever that thing that company is, and that last year their entire 12 months of electricity bill was a little under $500. And so they got an email from that, which is great for a year. And then they had gotten an email saying, okay, these storms are about to hit. You might want to get on a fixed rate plan. So they contacted Reliant. Reliant said, we can do it, but not till Wednesday. Their bill from Saturday, Sunday, no, it was Sunday, Monday, Tuesday, and half of Wednesday. So 3.5 days was literally almost $1,500. I know, it is. And they got a brand new baby. Right. Yep, exactly. Exactly. Mm-hmm. Mm-hmm. I know. I know. I mean, you still have to pay to freeze your butt off. It's crazy. Crazy. Yeah, we were real lucky. We kept power and water. And I found out through a neighbor of ours who's in kind of the electricity business. He said that usually when you're on the same grid as a hospital or a fire station, which we are, you tend to not lose. And so we've got a fire station right behind that backs up to our neighborhood. And so, yep, so I think we were fortunate. Yes, but my youngest daughter in Austin, they went almost a week with no power and no water. Yep, yep. Oh, I know. Yes, yeah, absolutely. Okay. Hmm. Sure. Okay. Hmm. Hmm. Okay, 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 perfect. That works. Yes, I did. Yep. No, no, no questions. Okay. Okay, perfect. Perfect. Mm. Yes, yep, yep. And then they gave me my actual diagnosis on my 46th birthday on May 22nd of 18. I know, and I'll never forget it. I was in Dallas Methodist, and I remember when the doctor came in and said, well, it's definitely cancer, da 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 da. And I remember looking at him and saying, you do know today's my birthday. And he said, oh, yes. And just kept going. I'm like, okay, just cool, making sure. Yeah. Yes, yeah, when's your birthday? Yes, that's exactly right. Yeah, see, my oldest daughter, she's May 14th, so she's not a Gemini, but yeah, she should be though. She should be. Oh, okay. Yeah, yeah. Excuse me, what are you trying to say? What it actually it started is it started with extreme upper back pain that literally was just shoulder blade to shoulder blade, and it went horizontally, and then over, and that had started about 6 months prior. But as towards we ended the end of 17 and then into the beginning of 2018, it literally just started radiating up my neck until finally come March and April, I just could not, well, I actually had an appointment April 12th with a back and spine specialist, and I was trying to hold out, but the pain just got so bad that I had to end up going to the ER, because it got to where eventually all the way up my neck, the back of my head, all the way to the front, even, I mean, the roots of my teeth hurt, my eye sockets, I mean, extreme pain. And that's what and I can take a lot of pain, a lot. And I couldn't do it anymore. It just got so unbearable that I couldn't function. And so they sent me in, or the ER did, of course, you know, a typical x-ray. And they're like, well, you do have some disc issues. And they're like, but let's just send you to a back and spine doctor, you know, around the corner to do an MRI, which is actually what I had been wanting, which is why I had an appointment in April with a back and spine specialist to get that MRI. But I couldn't hold out that long.
And then, so then they diagnosed you on the 22nd.
Uh-huh.
It looked like you underwent the proton radiation.
Yes, I did that in June and July. Uh-huh. Mm-hmm.
Okay.
Yep.
So it was, I had the dates, I had like June 4th to July 16th, so it was probably shorter than that.
It started a little bit later, in maybe a week or so after that. And in fact, I, believe it or not, I actually ran across it. I still have my radiation schedule. I think my last day of radiation was, I believe I want to say July 24th or 25th. And of course I've got the actual paper copy, but I may even have a thing of it on my phone. Oh, yep, here we go, actually. Let's see. Okay. It looks like, well, and of course this is on my phone, so it looks like it might have cut some of it off, but definitely I was doing it on June 11th. And then, let's see. And of course my phone cut it off, but July 16th I was still doing it. But I said, I think I actually graduated on like the 24th or the 25th was my last treatment of July. So yeah, basically, you know, around the first week of June through the last week of July.
Okay. And then it looked like, so it's right since cervical spinal cord, kind of that area, and then it looked like you were stable, and then January of 2019 they started seeing some growth, so
Yep.
they started you on Timothy.
Yep.
And you had that until July of 2019.
Actually, I did Timidar through, I believe, October of 19. She wanted me to do a year, and about month 10, I think it was, and like I said, I would have to go get my actual medical, find it. But I was so sick on it, I couldn't do it anymore. And with the day that I called Dr. Fink, my neuro here in Dallas, to tell her, okay, I'm tapping out. You know, I can handle a lot, but this is no quality of life. She said, well, actually, we were going to call you today anyway because your last scan showed that it's on the move again. And so I went, okay, well, perfect timing. Good, let's stop.
Yeah, okay. And then was it, so did you, because I had that you had the craniotomy for the tumor biopsy and everything, and I had that being September 16th of that year. So did you stop the Timidar before that, or did you?
Let's see. Oh, you know what? Actually, yeah, you're right. It would have been about, I said October, about August. Yeah, August. And then September 16th, 19, that same year, is when I had my craniotomy. Yep.
Okay.
There we go.
And then it looked like from that point, stable, but then I know you had the scan in January.
Yeah.
And it looked like for most part it was stable.
Yeah.
Just kind of wanted to see if there was treatment options to kind of attack it a little bit.
Yeah. The radiation oncologist and then my neuro said that, you know, that it showed a slight growth, but that we needed to go ahead and jump on it to see what else we can do to prevent it from doing anything else.
Okay. All right. And did they, were they more like, okay, let's look at the clinical trials, or did they have like an option that they recommended for you as well for systemic treatment? Originally
what they did was refer me to the NCI up in Bethesda, Maryland. They took a look at it and basically kind of were, as weird as it sounds, almost afraid to touch it. They were like, no, we don't know if we want to treat it. And they're like, but we do want to do a natural history study on her. So I'm actually working with them because this has just not been found apparently in another adult where mine is located. And so they're going to be following me throughout the rest of my life to kind of document, whatever we can learn about it. And so between NCI and then Dr. Fink here in Dallas, they referred me to you guys. And so basically, when I left her in January, my options were going to be MD Anderson, clinical trial, stay here locally, and if she does treatment, it would be IV carboplatin or something like that. I don't know how to pronounce it. Or else option 3, just leave it into God's hands. And so, and then I will see her again on April 19th for my next scan because we went back to 90 days. And she said, let's see what option you come up with and what your answer is. She said, but at least I'll give you till April. And I said, okay.
Yeah. Okay. All right. Well, that makes sense. All right. So then, so I got that. So then the next thing, and I saw the medical history, like from the records. So I just want to make sure I have all of them correctly. So I have, let's see, sleep apnea that was diagnosed in 2017. Do you still do sleep with a CPAP?
Nope, not at all. I ended up having weight loss surgery and lost 300 pounds. And so that took everything away. Yeah. For 20 plus years, I was 400 pounds.
Oh, wow.
Yeah.
And so, look, I may have had that.
Yeah, I had that in November of 14. Yep.
Okay. All right. So I
And
should have
yeah.
Okay.
And of course, by the time I got a large quantity of weight off, it dissipated.
Oh, what was it?
By the time I got, after I got like 200 plus pounds off, it just finally went away. And so yeah, I'm totally fine with it now. I have no issues.
And then because of the bypass surgery, they just had in there like altered bowel function. Because
Yes.
of that,
Yep.
okay. And then I also have like high cholesterol, high blood pressure that were diagnosed in 2019. Would you say those are pretty well controlled?
Yep, they're completely gone actually.
Oh, okay.
Yep.
Right. And then also hypothyroidism about that same time. as
Yep,
well.
gone. Yep.
Okay, so you are on for that. No Synthroid or anything, it looks like.
Nope, nothing.
Okay. And then let's see. And then they had in there like OCD obsessive compulsive disorder diagnosed in 2012. Right? And then okay. And then let's see. They had kind of like a mood disorder. They didn't really specify what that was. Is it have like another diagnosis, or is that kind of the main one?
No, I guess that would be the main one. Yeah, no, and I don't even take anything for that. It's, off and on over the years, they had tried to give me things because at one point my anxiety with it was real high, but it's and a lot of it has gotten better with age. In all honesty, it's like the older I get, I'm like, it's fine. Let it go. But yeah.
You realize it's kind of like out of your hands.
Exactly.
Once we get older, we're kind of like, all right,
Yes.
before I know.
Exactly.
Yeah.
Yep. 100%.
And then the other things I had, they had bradycardia or low heart rate in 2017. And was that just like an incidental finding?
I have always had it. Basically, ever since I lost so much weight, every single time I'm in the hospital, it never fails like clockwork, whether I'm in overnight or for 2 months. They will come rushing in the room, waking me up. You're not breathing. I'm like, I was sleeping actually. And they're like, you set off every alarm out there. And now, especially when I have hospital stays with hospitals that have gotten to know me, they literally make notes. Oh, she's fine. She'll set off the alarm, but she's fine. They would come in, test me. And they think it's just because of the fact that I'm just so tiny and I lost so much weight. But yeah, but it took forever for people. They would they would be going crazy. And they're like, but you seem fine. I'm like, well, considering I was sleeping, I was.
Now I'm not.
Yes. Right.
And then the last one I had was like osteoarthritis. That was diagnosed in 2017.
Yes. Yep.
Okay. All right. And then kind of more specific questions. Have you ever been diagnosed with like neuropathy, numbness, or tingling in your
Yes, yep. I've got it in my legs and I have it in my left arm and especially hand. My legs, it started after radiation. And in my arm, in my left arm and hand, there it goes. Wow. In my left arm and hand, it was basically a result, it was one of the deficits from my craniotomy, which we knew that that could, cause it. And so, yeah, but it's nothing that, I'm able to work around it. And I just know not to, if I'm going to carry my hot coffee, I carry it in the right hand and not the left, just basic stuff. Yeah, yeah.
Is that why you're on the Cymbalta or the duloxetine to kind of help?
It actually, it does a couple things. It's for mood, that, and it helps with sleep. So it kind of tackles a couple of different things.
Oh, good. Okay. All right. And then, have you ever had, or ever been diagnosed with diabetes?
Nope, never.
Okay. What about, have you ever had a heart attack or stroke?
Nope.
Okay. Have you ever been diagnosed with a blood clot?
No. Nope.
Okay. What about an autoimmune disorder, like Crohn's?
Yep.
Lupus?
Nope. Yep. And of course, they tested me for all that stuff before.
In the last 1 to 2 months, a blood transfusion or a hospital admission?
Let's see, last one. Nope.
Okay. What about any recent steroid use, like prednisone, dexamethasone, like last 1 to 2 months?
Yeah, nope, none.
Okay. What about any antibiotics last 1 to 2 months?
Nope.
Okay, perfect. So then let me move that. And then for surgeries, I had the gastric bypass, I had the total knee replacement in 2017.
Mm-hmm.
Had a right nephrectomy. They took your kidney
Uh-huh.
out. What is that related to?
Basically, when I went in originally having real bad stomach pain, and they discovered that it was my gallbladder, and more, which we kind of knew it was going to happen, especially with the weight loss surgery. And while they were in there, they started noticing on a lot of my testing, which I've had kidney stones so bad off and on over the years that I have had so many lithotripsies I can't even count. And they discovered that my kidney was functioning at a little less, or my right kidney at a little less than 7%. And so so they said, that's anything under 20 is pretty much useless. And that was the one kidney that I had the most problems with. Even though I've got stones in my left kidney, they said they could have been there for 2 decades. It was always that right kidney that they would have to go in and do the lithotripsies on. And so once they realized it was functioning that low, they just went ahead and removed it.
Okay, so it's mainly so you get on the right side, you get on, you had
Yep.
multiple lithotripsies.
Yep.
Alright, I'm adding that in there throughout years. Okay. So then we have that nephrectomy, and then so I guess the first knee replacement was the right, and then you had a left one as well.
Yep. Oh, that is so crazy.
I really start glowing when it turns out. And then I had it here, like the bladder surgery, like you mentioned, the craniotomy,
Yep.
and then you had a bladder suspension in 2017
Yep.
and 2020.
Yep.
Okay.
Yeah, in 2020, the one that I had last year, basically because throughout treatment and ever since my diagnosis, originally when he did it, it's because when I lost so much weight, especially tummy weight, my bladder had prolapsed out. And so he went in and fixed that, as well as did a hysterectomy and everything around the same time. But then in 2020, I started having bladder issues again. And because I had lost like another 30, 40 or so pounds throughout treatment and just since diagnosis, it kind of caused it to drop. And so he went in and kind of re-put it back up. Yeah.
Okay.
In 2020.
Okay, so I missed the stretching, but I have it on there. Okay.
Yeah.
So that makes sense. And then for family history, the ones that I found was maternal grandmother had breast, and maternal grandfather had like an aortic aneurysm.
Yes.
Is there any other family histories that
No.
you're aware of?
Yeah, nope, none.
All right.
Well, my mother.
Have you ever had smoked or you smoked tobacco, anything like that?
Nope. My mother actually last year, around the same time that I think that I did my last bladder surgery, the same doctor, because she now goes to him, diagnosed her. He caught it super early, but endometrial cancer. and they went in and were able to just do a hysterectomy, take everything out. She never, and it was literally like I think it was endometrial, like 1A. It was basically, they caught it so early it barely even registered. And so and that's the only history.
Who was that?
My mother.
Okay,
Mhm.
so let me add that.
Mhm.
Endometrial. And then, okay, and I'll add that. And then what about any alcohol use?
Nope.
No. All right. Any other drug use, anything like that in your history?
Nope.
All right. So I'll put that. Right. And then are you currently working?
Uh,
Early retirement, anything like that?
yeah, no, I'm on disability. Yeah, when all this happened, I got put on disability.
Okay. What did you do before you went on disability?
I actually was in the daycare business for 23 years.
Oh, wow.
Yep,
Oh, my
yep.
goodness.
Yep, I did childcare. Yep. Yeah, I had a small business of my own for almost 23 years that I ran an in-home daycare. So,
Oh, wow.
yep.
Oh, my goodness. So how many kids did you have at the time?
I could have anywhere up to 10, but I usually had around 7.
Oh, wow. Oh, my
Yeah.
goodness. You should.
That's so funny.
I gotta keep moving. That's fine. That's fine.
Yeah, that is so funny. That's genius, though, that it does that. It's smart.
Alright, let me put this on here. And then, we do like to just have updated in our system if you have, like a living will, power of attorney, whichever of those.
Yes,
Okay,
yep.
who is your, like medical proxy?
My mother.
Mother, okay. Right, so put that on there, perfect. Okay, and then, we've already talked about it a little bit, but with the neuropathy that you had, what other symptoms have you noticed related possibly like to your cancer diagnosis?
I've got some slight balance issues. You know, it can be a little wonky at times. Um, my legs and arms sometimes will just kind of kick themselves out, you know, out of the blue. It almost looks like somebody scared me and I jump. And then I've got like my vision. I've always had 20/20 vision, and I noticed that it started changing about a year or so ago. And so for the first time in my life, I have prescription glasses, but literally in a matter of 3 months, my vision went from 20/20 to now it's like 21/66. So one side is my left side is a prescription reader, and then this side is like a no line bifocal. But I also have like blurred vision and double vision, but it's never been anything that's caused a major problem. You know, it about as quick as it comes on, everything will come back into focus, and so it's never been an issue.
Okay. And then I saw that you answered some of the questions as well that, like fevers, when was your last fever?
Yeah. Oh my gosh, I run fevers almost nightly. Almost, yeah. It's day and night. It is so common, and it's just they say that it's just to where the tumor is and where it's setting and pressing. And it's just they can just spike up for no reason, and then they'll just disappear for no reason. And of course, I'm so used to them now. But yeah, and they're always worse in the evening and at night. And then kind of like the same thing with the nausea. I have a lot of bad nausea and vomiting. And they said that where the tumor is sitting also is kind of pressing on the nausea and vomiting central, you know, per se. And it's just something I'm used to. And, you know, I go 24/7, just almost, you know how when you're sick and you feel like, oh, I think I'm fixed to get sick? That's, if my eyes are open, that's pretty much how I feel. I'm just used to it now.
Okay.
Yeah.
How high do the fevers get?
Usually for the most part, they stay fairly low grade, you know, around 99, but they can spike up to 102 quite easy. And of course, I'm a lot of times I'll do things like I'll get in a warm bath, or I'll do things that will help kind of break them. And that usually works. You know, if nothing else, I'll just go lay down, try to take a nap, and just let it run its course, and it'll go away.
Alright, so let me put a medicines in there while you're talking.
Okay.
Okay. Alright. And then let's see, and I looked through there, like your lab work that you had. Hey, where is it? Because I remember I looked through some, like from their documents and everything.
Mhm.
Overall, your labs look like they've been pretty good.
Yeah, they have.
Really
Mhm.
jumping out. And
Yep.
really what we kind of look at when screening for trials, we look at like the CBC and your
Mhm.
hemoglobin.
Mhm.
We make sure, I tell everyone we're not looking for it to be completely normal. So
Yeah.
normal for a female is 12. We like it above 9 typically.
Okay.
Each trial is different, but that's kind of the baseline. And then we look at like kidney function,
Mhm.
liver
Mhm.
function,
Mhm.
just with how the meds will be metabolized and stuff.
Right.
So
Right.
I kind of looked through your trends and stuff. I didn't really see anything that jumped out. So
Yeah.
everything looks like it's been pretty good.
Yeah. Even when I was on chemo, okay, because I had to go every Monday for labs, I was very fortunate. They stayed really pretty good. So I was very, very lucky. Very lucky.
And I will say, so the one thing I couldn't find in documents or anything, is that in the reports, Dr. Fink's reports, she was saying you have this BRAF mutation.
Yes.
And I couldn't find like the actual Tempest report. Do you have the actual copy of that?
Yeah, I sure do. You want me to go grab it?
Oh yeah, if you could while I'm talking to him, maybe like if
Yeah.
well, you may not have it like saved somewhere, because we can always send it through like my chart or through email if
Yeah.
you're able to, so
Yeah.
we can get that uploaded.
Okay.
I can give you my email if you want to
Okay.
send it to me.
Yeah.
I can give it in your chart.
Yeah, absolutely. Yep. And let me go ahead and write your email down. Yeah, what is that?
G as in girl,
Uh-huh.
E as Elizabeth, and then URSCHEL @mdanderson.org.
Okay. All right, let me go over
It'll be a
this.
couple minutes before he hops on here, so if you haven't saved or anything, and then I can get that uploaded in your
Okay.
documents, that would be great.
Okay, yeah, I don't have it saved, but I can definitely, and I'll also go grab it in case there's something that y'all need off of it right now as well. Yep, I'll do that. Okay, perfect.
Well, I'll go grab him. It'll be a couple minutes, and then I'll just turn my video off.
Okay.
Let's both stay connected, otherwise we'll lose each other.
Okay, that'll work.
Okay, so it was very nice meeting you. Like I said, he'll be a couple minutes, and then he'll hop on to meet you as well.
Okay, that's perfect. And you know what? Let me just double check your email. So it's girl Elizabeth Universe Rock Sock Carri, I don't know, house elevator laugh.
That's perfect.
Okay, mdanderson.org. Okay, yep, that'll work. Okay, thank you, Bree. It was nice talking to you. I'll see you in a little bit.
Okay, sounds good. Bye.
Uh-huh. She's gonna come back with the doctor in a few minutes. Oh. They couldn't find a copy of my, no, I can find it somewhere. Of my, DNA Tempest, there we go. Advanced sequencing, yeah, that's what she wants.
Yeah, it's cold in here.
It is, that's where, yeah, I switched to a long sleeve shirt and, I'm feeling really good actually. Yes. Yes. I mean, being that I'm only like 4'9", 4'10". Well, today actually I weigh a pretty good amount. Today I was 102 pounds, but I've been holding steady about 95 pounds, which I think for me is great, being as short as I am. So.
Okay, all right. And what I was trying to figure out, this nausea and vomiting that you had, is it more from the cancer itself, or is it actually from the bypass? What kind of combination of all of the above?
No, it's probably about 80% just the cancer and the tumor, and only about 20% from my bariatric surgery. Yeah, I never really had much of a problem with it until, I guess basically the tumor started creeping in, and they feel like that it's kind of pressing, on nausea and vomiting central, and so it just kind of makes me nauseous and sick quite often. But I've gotten so used to it now. And like I said, and I do really fairly well at maintaining, my weight.
So, one more question would be, you take Zofran and Compazine, right, to manage your nausea?
Zofran as needed. I've got Compazine, but I rarely have to take it.
So let's say if you end up taking Compazine instead of Zofran, do you think would it control your nausea, or it would be good enough?
Honestly, so far we've never had anything that's ever been able to really fully control it. Those two tend to work the best out of everything.
So the reason why I'm asking all these questions
Mm-hmm.
is because the medication which I can offer you is called BLX 8394. BLX is like Peter, Luke, Xerox,
Mm-hmm.
8394.
Mm-hmm.
And it's actually a brain penetrant inhibitor of BRAF, which
Mm-hmm.
is mutated in the tumor.
Mm-hmm.
So it actually does go well to the brain.
Mm-hmm.
It's a medication which we have been working on for quite some time, and we already accumulated, so it's still technically early phase clinical trial.
Mm-hmm.
You actually treated patients, including patients with brain tumors, and you've seen actually some level of shrinkage in most of them.
Oh wow.
So that is actually that, which is quite exciting.
Yes.
I have some concerns which I will have to kind of figure out if we can get around them. One of them is that the ducts itself can cause nausea and vomiting.
Mm-hmm.
It's usually fairly mild, but that would be confirmed in someone who already has nausea and
Mm-hmm.
vomiting, because
Mm-hmm.
it might be potentially a more problem than maybe in some other patients.
Mm-hmm.
Other than that, it's not that bad, because there are patients who are on this medication for years, so clearly nausea and vomiting cannot be that bad.
Right.
Again, I'm afraid that you already have some baseline. And then you already gave heads up to the company, and I still have to think, but one of the things which they might potentially push back on is because of you have a gastric bypass, that it might affect the ability to absorb the drug.
Mm-hmm. Mm-hmm.
Hopefully should be alright.
Mm-hmm.
And if you get your PLX, I would look into Zofran and try to manage nausea with something different,
Mm-hmm. Mm-hmm.
such as Compazine or something else.
Yes. Yeah.
Okay.
Yeah.